So we'll start again with this particular poster. Here we are showing the safety. I'm not going to go into the details of the introduction, but what I do want to mention that I did not mention in the previous poster is adherence is a big problem. And we all know that the percent of patients who are adhering to GLP-1 receptor agonists are between 35 and 50%. So you can see that a lot of people do not reach their goals of A1C because of non-adherence. So in this particular poster, what we have done is we have done a post-hoc analysis of the safety and efficacy of two of our pivotal clinical trials, which are in phase 3. The first trial, Freedom, had 3 arms in the study. One was a 20, followed by the 40 microgram dose. The second was a 20, followed by the 60. And then the third one was a placebo, which was also a double dummy. So they all had the device, even the placebo patients. In the second study, this was a head-to-head comparison of the ITCA versus sitagliptin. So there were 2 arms. The first arm had the patients who were on the 20, followed by the 60, and the second arm had the sitagliptin. And all of these patients were on metformin also. So when you look at the analysis here, the demographics are pretty much characteristic of all GLP-1 phase 3 studies. The basic data here shows that the reduction in A1C for the 2060 arm was about 1.4% compared to sitagliptin, which was 0.9%. The weight loss for the ITCA was 3.5 kilograms compared to about 1.1 for the sitagliptin and 1.6 for the placebo. The composite endpoint of weight loss of 2 kilograms or greater and an A1C of 0.5% or greater was about 37% of these patients achieved this endpoint versus 16% for the sitagliptin arm. Similarly, when we had a weight loss of greater than 3 kilos and an A1C of greater than 1%, 27% in the ITCA arm had achieved that goal versus 9.8% in the sitagliptin. And then patients who achieved less than 7% A1C was also quite dramatic, about 39% in the ITCA arm compared to 23.3% in the placebo arm, in the sitagliptin arm. If you look at the change in A1C over a time course of 39 weeks, what you see is the placebo is right up here, the ITCA is over here, which shows the mean loss of A1C, decrease in A1C of about 1.4%, and the sitagliptin is shown in orange here. Similarly, when you look at the body weight, the change in body weight, again you see a dramatic change in body weight with the ITCA compared to the placebo and the sitagliptin. Now going into the AEs, what you notice here is that the number of AEs in the ITCA was higher than either the placebo or the sitagliptin arm. However, most of the AEs were due to nausea, vomiting, and diarrhea. And as I had mentioned before, most of these were either mild or moderate. And most of them happened within the first 2 weeks of placement of the 20 microgram device, and then 3 months later when they were switched out and put into the 60 microgram device, again they had a 2-week period of nausea and vomiting, and then those went down. There is not a whole lot of other things to discuss in the AEs here. The discontinuation rates were pretty much similar across, actually the serious AEs were pretty much similar across all 3 arms. The discontinuation due to the ITCA was a little bit higher compared to the sitagliptin and the placebo. So in conclusion, what I can say is that we got a significant lowering of A1C weight loss, composite A1C weight loss, and also goal attainment with the ITCA compared to either the placebo or the sitagliptin. Thank you.